On November 8, 2013, Typhoon Haiyan's winds drove huge waves ashore, crashing into villages and towns of the Philippines.
It flattened buildings and ripped families from one another. On record, Haiyan was one of the largest storms ever.
It's been about a month since the typhoon hit land, but the crisis is not yet over.
Many families are searching for food, finding whatever they can in the garbage and rubble that was left behind.
The water supplies were damaged by the storm and are no longer safe to drink.
The hospitals that were not destroyed or severely damaged are overcrowded with patients and their medical supplies are running low.
Doctors Without Borders is one group of everyday heroes working to make a difference in the lives of those who have lost so much and yet survived this unprecedented disaster.
Their teams are working in a number of places, running hospitals and mobile clinics in both cities and rural areas.
The mobile clinics are focused on visiting remote villages where they provide basic health care to people who have received little or no assistance. Patients that are very sick are sent to hospitals like the one in Tacloban City.
There they've set up an inflatable hospital. In the mobile clinics there are also many patients with hypertension, diabetes, and cardiac conditions.
They are also supporting health centers in the Philippines that have been damaged or can't handle the number of people seeking medical attention, while their psychosocial teams have been focusing on providing mental care to patients.
More than 15 million people have been affected by Typhoon Haiyan, and over 4 million people have been internally displaced.
Along with medical relief, their teams are distributing shelter materials, hygiene kits, cooking utensils, blankets, and mosquito nets, especially to the remote villages that have been completely destroyed.
Most of these areas are homes to poor farming families where the vulnerability is much higher.
They're also handing out something they call reconstruction kits. These kits include things such as plastic sheeting, hammers, nails, and other tools to help build temporary shelters until long-term solutions for homes are built.
The reconstruction after Typhoon Haiyan isn't going to be quick. It's going to take many months, and that is why we need your support.
Here, halfway around the world, people in the United States are being affected greatly by what has happened. I personally have family there in the Philippines, and it was really scary whenever we first found out about it.
This isn't the kind of thing that you expect to happen to you. It always happens to everybody else, but when something like this does affect people who are near and dear to your heart, it makes you realize it can happen to anybody, and you just want to do something about it.
Buildings around the area that my family lived were destroyed, and a chapel was completely flattened. And at first I felt hopeless that I couldn't help them, and I just felt stuck here. And Doctors Without Borders has given me, and probably a lot of other people here, hope that we can make a really big difference.
I have family in the Philippines, and I'm really happy that Doctors Without Borders is helping out with what's happened.
Doctors Without Borders is donating medicine, supplies, and other medical equipment wherever needed in the affected areas. And their water and sanitation experts are distributing clean water both to the local people and to the damaged health centers.
I'm Anna. And I'm Hannah.
And I'm Mrs. Muller, aka Stan's mom.
And we represent the Castle Nerdfighters in Newburgh, Indiana.
Part of our mission is to make the world a better place.
And that's why we're supporting Doctors Without Borders and the relief funds in the Philippines.